Good morning. Good afternoon. Madhu Pampodi lecture here. Good afternoon. Can you guys hear me?
Good afternoon, sir. We can hear you.
Okay. Right. So today we are going to discuss on common endocrine presentations. Let me start screen sharing. Can you see the screen?
Yes, sir, we can see the screen.
So the objectives are to recapitulate the endocrine system as a whole, to understand multiple actions of the hormones, introduce students to classical presentations due to endocrine disease, and to introduce to common presentations. So I think all of you guys have had enough of these, that the hormones are chemical messengers secreted from one place and doing the action commonly in other places, but also sometimes some can have paracrine effects on the same organ. And it can have wide variety of effects. So one hormone can have wide variety of effects. If you take the thyroid, it can have wide variety of effects. And then also, one single hormone may be involved in several bodily functions. And several hormones may also have influence our body for the growth and development. So therefore, we need to understand that abnormalities of several hormones may have similar clinical effects, and the abnormality of a single hormone may lead to multiple clinical effects. I don't want to go into details. You know about the endocrine system, the thyroid, parathyroid, and then the pineal, the pituitary, and the hypothalamus. Then we have the and then the renal kidneys have some hormonal effects like erythropoietin and so on. Then the adrenal glands have also steroid hormones. So I don't want to go into details in this one. You need to understand important functions of the endocrine system so you can appreciate the effects of endocrine dysfunction. One important thing of the endocrine system is the growth and development of an organism. And then energy metabolism, regulation of body water and the electrolytes. The internal milieu regulation is greatly determined by the endocrine system. And therefore, by this mechanism, the extracellular fluid volume. Also reproduction. And also there are a lot of good effects on bone physiology and calcium homeostasis. So the growth and development, the growth means the increase in the linear height of the humans and the linear length of various other organisms. The development means where the minute form of an organism. For instance, in humans, this small baby becomes an adult who can perform the usual functions expected of that organism, including the self-feeding and so on, self-defense, and the reproduction of that species. In the frog, it is the toad from an egg, which becomes the mature toad. And then in the case of butterfly, an egg becomes the larva, and then the pupa, and then a very nice, beautiful butterfly. So that is what we understand by growth and development. So I told you a lot of hormones are acting upon and responsible for our growth and development, namely growth hormone, then thyroid hormone, and then the sex hormones also plays a role in the final sort of development of a person. So abnormalities of these hormones leads to abnormalities of growth of the body. And if you take the growth hormone deficiency, growth hormone is primarily responsible for the linear growth. So if there is growth hormone deficiency, there will be a small size person otherwise having normal morphological phenotypic features. So only abnormality predominantly is the short stature. So see two siblings, I think they are twins, unrelated twins, but see the one with growth hormone deficiency. At the same time, growth hormone excess, if it happens before the maturation of our skeleton, we can become a giant. So there's increased linear growth. So these are some abnormalities of growth. And then what would happen if the growth hormone excess happens after the skeletal maturation? You cannot increase your height or the length, but the parts of our body which can enlarge would enlarge. These would include the lower jaw and some parts of the facial bones and the hands and a lot of soft tissue enlargement. So the condition is called acromegaly. Acro means the acral parts, the distal parts. The hands and feet become enlarged. You see the spade-like large hands in this woman and the large mandible here. If you look from a side, the mandible would jut out from the maxilla. We call that prognathism. And then your nose become big and supraorbital ridges, these become big. And you will get a big tongue, macroglossia. And the foot also would increase and the shoe size will increase. So the development, on the other hand, is the transformation of a young, early organism to an organism that can reproduce as well as carry out other functions of that species. Now, here is a situation you can see. The thyroid hormone deficiency leads to both it affects both the growth and development. So you would get an abnormal and short person. This was used to be common when there was congenital hypothyroidism, which was not corrected at proper time. So it's called cretinism. Short person, usually the brain development is not happening properly. So there is learning disability, and then the sexual maturation also might not happen. So that person will not mature normally according to that the gender and so on. Cretinism. Then there are various hormones which are important and acting upon our energy metabolism. For instance, the insulin hormone is such, and also the thyroid hormones. So the deficiency of some of hormones as well as excess can lead to different issues with regards to our energy metabolism. So diabetes mellitus, due to deficiency of insulin, which is the main regulator of fuel in the body, and as a result, there's excess glucose, and as well as excess fat breakdown, as well as excess protein breakdown. So this is what happened to a type 1 child due to severe insulin deficiency. And this is the same child after replacement of insulin. And lately, when particularly there is no absolute insulin deficiency, the chronic hyperglycemia has been shown to damage the mainly several tissues. The retina leads to retinopathy, nerves leads to neuropathy, kidneys leads to nephropathy. And then in addition, it can also cause premature atherosclerosis leading to heart attacks, stroke, peripheral vascular disease. Hyperthyroidism. Hyperthyroidism is a condition where there is excess thyroid hormones in the circulation. So if you know the actions of the thyroid hormone, that is to maintain the basal metabolic rate, you can easily work out the effects that can happen due to hyperthyroidism. So if there is excess increase in the basal metabolic rate, this will lead to excess of energy production. So what would happen if there is too much of energy production in our body? There would be weight loss. So as a result of excess energy, wastage, we need to take more energy. This leads to increased appetite, and this leads to increased heat generation in the body. So since there is increased heat generation, we will become intolerant when there is heat. So we call this heat intolerant. And so the body tries to dissipate this heat by increased sweating. So for all these, the heart needs to work fast to take blood in, circulating more in the body. So the heart works faster and harder. You start feeling the heartbeats. We call these palpitations. And then when the bowels start working faster, the bowel opens more often, and we get diarrhea or increased frequency of stools. Hypothyroidism is completely the opposite of what I have told you. So there is less speed in our basal metabolic rate. So there is less energy production. So there is preservation of our energy in the body. So there is weight gain. So there is reduced heat production. We'll get what's called cold intolerance, less sweating, reduced bowel movements. So we get constipation, sleepiness, lethargy. And also people can get amenorrhea. Women can get amenorrhea as well as menorrhagia, because the uterus does not contract properly. They can get menorrhagia. So these are the effects of hypothyroidism. Goiter is a very common presentation of thyroid abnormality. So any cause that leads to increase in the size of our thyroid is called a goiter. So this is a very common endocrine presentation. So just to come out of the boredom, can you guys tell me the answers to the following questions? What are the hormones important in growth and development? Someone can shout.
So growth hormone, thyroxine, and sex hormones.
Good. What is the condition that occurs when the growth hormone is in excess in adults? What are the hormones liberated from the posterior pituitary?
ADH and oxytocin.
Yeah. And what are the common causes of short stature? Anyone? No answers?
Growth hormone deficiency.
What else?
Congenital hyperthyroidism.
Yeah, hypothyroidism, growth hormone deficiency. And there are a lot of other causes actually, which I have not told you. It can be due to even other non-hormonal causes like malnutrition, chronic disease, and familial, right? And so on. We might discuss some of these in the endocrine module. So the endocrine dysfunction leads to abnormalities in reproduction. So there can be disorders of puberty. There can be delay in the puberty as well as early puberty. So early puberty we call precocious puberty. So both ways it is not good. Delay of puberty can lead to the delay in our development of secondary sexual characteristics that should be there for that gender and can have issues in the reproduction. Early puberty also is not good. For instance, a 6-year-old girl started menstruating can become a major social problem. And also a 6-year-old boy, having puberty and going behind older girls and aunties and so on can lead to a lot of problems. So these both ways, that's not good. And then there can be abnormal secondary sexual characteristics. For instance, if there is too much of testosterone or its effects in a woman, that woman starts getting too excess hair, male-like baldness, male-like physique, clitoromegaly, and so on. And similarly, in a man, if there's deficiency of testosterone, that can lead to erectile dysfunction and reduce growth of the beard and so on. And then endocrine disorders can lead to amenorrhea or oligomenorrhea in women, subfertility, then as I said, erectile dysfunction and female sexual dysfunction. So all of these issues can happen due to endocrine disease. Actually, I have not shown that in detail, but endocrine problems can happen not just due to the issues in the gonads, because we know that there is more intricate control of our endocrine system. So the gonadal function is dependent on particularly FSH and LH from the pituitary, and the FSH and LH from the pituitary is under the influence of GnRH, gonadotrophin releasing hormones from the hypothalamus. And also these are also under the influence of various other hormones like prolactin. Prolactin is the milk, hormone that is responsible for milk. So evolutionary, if you take prolactin, that hormone helps the mother to lactate after childbirth. So another important thing that should have happened when the man was living in the Stone Age in the jungles was that when the woman is lactating, she should not have another child quite sooner, because that the earlier child would get sort of lost in the jungle and would be eaten by the animals, as well as would not be given adequate nutrition and attention and so on. So the prolactin has an effect where it will have negative effect on your gonadotrophins and thereby the sex hormones. So the woman will not get periods normally, will not be normally fertile, and not have a normal libido when there is increased prolactin. So similarly, if there's increased prolactin in a man, the same thing should happen. The man would have erectile dysfunction and also the subfertility and so on. So disorders of puberty, I told you about this regulation, GnRH, LH, and from the gonads, the sex hormones, the testosterone in man, estrogen in woman. So the puberty is a young small boy becoming a man, and in a woman, it is a young girl becoming a woman who can reproduce with the all the secondary sexual characteristics like the breast development, pubic hair, menstruation, and so on. So the hirsutism, excess hair in a woman, can happen due to excess androgenic effects. It can be a bit severe, and like this, when it is like the associated with male type baldness, we call this virilization. So this is the sort of the schematic representation of hormonal changes, endometrial changes that happens in the menstrual cycle. You can see if there are problems in the hormones, it can lead to menstrual abnormalities. Then there are other hormones like glucocorticoids, which have also a lot of important metabolic functions. The glucocorticoid, the most important glucocorticoid is cortisol. This will come out of the adrenal cortex under the influence of adrenocorticotrophic hormone, and this is in turn under the influence of corticotrophin releasing hormone or the CRH from the hypothalamus. So if there's excess cortisol, you get a condition called Cushing syndrome, where there is catabolism, increased catabolism of fat, protein, and then as a result, there is increased excess glucose in the body and leads to diabetes. And then this hormone leads to abnormal fat deposition. You get the thinning of the limbs due to catabolism of the fat and the protein, and also the fat deposition in the central part of the body, the face and the trunk. So this is Cushing syndrome. The opposite is Addison's disease, where there is primary hypoadrenalism. In this condition, what happens is there's reduced cortisol and reduced mineralocorticoid, aldosterone, and reduced sex hormones from the adrenal. So weak, thin person is the, what happens, there is reduced blood pressure. And in this condition, another thing that happens is the ACTH will go high because of the lack of feedback inhibition of the pituitary. So this ACTH is a hormone that is related to pro-opiomelanocortin that is useful for melanin synthesis. So there's excess melanin synthesis that leads to increased pigmentation. So the disorders of calcium are hypercalcemia, hypocalcemia, and osteoporosis. Now, osteoporosis is a condition where there is weakening of the bones due to reduced bone density. And you can get a fracture, and also there is a gradual reduction of the bone matrix. Your height might go down, a woman might become stooped, and ultimately there can be a fracture, pathological fracture. I told you that some of the hormones act on the sodium resorption. So sodium is important for the maintenance of extracellular fluid. And so when there is excess mineralocorticoid leading to excess sodium, and along with that water retention, this can lead to high blood pressure. And we call this condition primary hyperaldosteronism or Con syndrome. I told you about the Cushing syndrome due to increased mineralocorticoids. And then sometimes there can be excess in the hormones that comes from the medulla of the adrenal gland. And these medulla of the adrenal gland secretes catecholamines, adrenaline, noradrenaline, dopamine, and so on. So this can lead to catecholamine excess and the condition we call pheochromocytoma. Since there are several hormones that are effective in maintaining the blood pressure, the deficiency of these hormones can lead to hypotension. The classic examples are adrenal failure, pituitary failure, and also there are a few causes of non-endocrine causes for hypotension. Weight gain. Several hormones, as I told you before, can lead to abnormal weight gain, abnormalities in the abnormalities in the storage of energy, and commonest form of weight gain is what you call the general obesity, which can be also associated with type 2 diabetes. Then specific conditions like hypothyroidism, Cushing syndrome can also cause us weight gain. So if there's weight gain due to hormonal disease, there should be weight loss also due to hormonal disease. So hyperthyroidism, increased energy burning. Then diabetes mellitus, Addison's disease, pheochromocytoma, and then many non-endocrine causes like malignancy, chronic infection also can cause weight loss. Now, the hormones are very important to provide us and maintain our basal metabolic rate and a lot of other functions. So if there's deficiency of some of these hormones, it can lead to lack of energy. Classic examples are growth hormone deficiency, then hypothyroidism, and then hypopituitarism, hypoglycemia, growth hormone deficiency, non-endocrine disease. So you have to be aware that hormonal problems can lead to lack of energy. I told you that hormones play a vital role in the electrolyte balance, and therefore along with the electrolytes goes the sodium. So if your water absorptive mechanism is erratic in the kidneys, then you can get a condition called diabetes insipidus. And then classic examples are polyuria, diabetes due to diabetes mellitus, diabetes encephalus, diabetes insipidus, hypercalcemia, or sometimes very rarely psychogenic polydipsia, or we call this primary polydipsia as well. Galactorrhoea. Galactorrhoea is the milk production of a otherwise non-pregnant or postpartum woman, and commonly this is due to excess in the prolactin hormone. I think I told you about the importance of prolactin hormone. So if there is prolactin excess in a non-pregnant, non-lactating woman, this can lead to galactorrhoea. So I think that is all that I'm going to tell you about the common presentations. We have a little time. If you have any questions, we can answer. Any questions? No questions? So no questions might be that you have understood everything or didn't understand anything. So I think in the absence of any questions, we will stop there. And I will get this lecture to be uploaded into the LMS also. Goodbye.
Thank you, sir.